The following is a Cable 14 special presentation.
Good evening. I'm Mike Fortune, and I will be your host for this, our weekly town hall meeting concerning the COVID-19 outbreak here in the city of Hamilton. Of course, we welcome everyone watching and listening on Cable 14, 900 CHML radio, and on the City of Hamilton YouTube channel. We would also like to welcome viewers watching on your TV in Burlington who are joining us this evening. Now, tonight we will continue to share the latest information and answer many of the questions you have regarding the current status of the COVID-19 outbreak within our community. And as always, joining us once again this week are Mayor Fred Eisenberger, Mr. Paul Johnson, Director, City of Hamilton's Emergency Operations Center, and of course, Dr. Elizabeth Richardson, City of Hamilton's Medical Officer of Health. Of course, we also welcome your participation in tonight's town hall meeting, and you can submit questions in one of two ways. You can go to the city's website at www.hamilton.ca/askcovidquestions, or you can reach us on Twitter by tagging @CityOfHamilton in your tweet. Once again, this evening, our staff are monitoring social media and our website, and we will get to as many of your questions as time allows. But before we start with tonight's questions, Mr. Mayor, it has been a week since we gathered for our last virtual town hall. Can you once again please kick things off by giving us a brief update about the COVID-19 situation in Hamilton from your perspective?
Mike, thank you very much, and thank you everyone for tuning in and for Cable 14 continuing to broadcast, as well as CHML. And a special thanks to our American Sign Language interpreters, Rosalie Visers and Georgia Whalen. We thank them each and every time for translating for the deaf. And I'm pleased to say that Hamiltonians continue to do their part to help flatten the curve. And I think in recent days we've had some positive indicators that we're meeting with some success. Certainly not over, but the work continues, and we need to ask our community to continue doing what they're doing. But I'm very proud of the response that we're seeing in the community at large. The recommendations of our public health experts for staying home, not gathering in groups, only going out for essentials, all of that is making a huge difference in the number of cases that we're seeing, the number of people that are getting sick. And hopefully it is flattening the curve and ensuring that we continue to stop the spread of this virus. The reality is, though, that the virus is still out there. It's not disappeared, and so we're going to have to continue to be vigilant on that. But the bottom line is it's working, and we need to continue on. We know that Ramadan is upon us coming up for our Muslim community, and we wish them a Ramadan Mubarak for those that are celebrating. This year, Ramadan, unfortunately, will be a little different, not unlike Easter, where you're going to have to celebrate in a different way in your homes or with your some virtual means to maintain that physical distancing and celebrating in some other manner than you're accustomed to. Very difficult to do, and certainly we all want to get together, but we can't at this point, and so that celebration will have to happen in other virtual ways that I'm sure that your congregations have come to look for to make sure that they can still connect with the community at large. Mental health and personal safety are very important during this time, and we encourage people to continue to get out in their neighborhood, get some fresh air, enjoy the sunshine, although it was snowing yesterday, which was a little freakish. It's April, but it's time for improving weather. So at the same time, you need to get out once in a while and get some of that fresh air. Some people might also be struggling with mental health issues, and we encourage you to reach out. There's a Coast line here at 905-972-8338. Do reach out if you're having issues. There's help for you at the other end of the line. And for kids as well that are possibly struggling or have domestic issues, there's a kids helpline as well that's constantly available to you at 1-800-668-6868. Or a text number, which is 686868. Thank you again to all of our frontline workers and heroes, the folks that are tirelessly working out in our community to keep our city functional, food manufacturers that are working at physical distance, but at the same time still continuing to deliver the products that we want to consume each and every day in our grocery stores. And a reminder that all of our counselors are available and working at their normal emails and phone numbers as they work virtually, but still work each and every day, contacting citizens or citizens contacting them and working through issues that might come up from time to time. If I might, Mike, just a couple of good news stories, and you know what, it's few and far between. But MIT Pharmaceuticals in Mississauga, they're donating an anti-malarial drug known as hydroxychloroquine to St. Joseph's Healthcare in Hamilton. They'll be using that to study the potential of that being a drug that could be helpful in terms of healthcare workers and their early treatment of cases. So Dr. Zane Chagla, the Associate Professor of Medicine at McMaster, is to be congratulated and thanked. They're working on some of that research to ensure that the potential of that drug might be utilized, and as well to Javier Singh, who's the CEO of Mint Pharmaceuticals, because they're providing the drug for testing for the McMaster. A shout out to a group called the Hamilton Community Organization in support of international students. We have many international students in our community, both at Mac and at Mohawk, at Columbia College. Some of them may very well be in need. They're far from home and obviously having difficulty getting home and living here and not necessarily getting resources. So there is help for you. An organization that is put together by Sabu Joseph at Mohawk College. You can connect with Mr. Joseph at sabu.joseph, sabu.joseph at me.com, or at equity at mcmaster.ca. So any international students out there, there is help for you. Do reach out and get some assistance from them. And lastly, a shout out to Cindy Lawson and her partner Alex Woodley Balo of Ancaster. They founded a group called Hammer Feeds the Front Lines. They're raising money to pay for restaurant meals for our frontline healthcare workers, a benefit, a bonus, like a way of saying thank you. They're raising money. I was happy to support their cause in the GoFundMe campaign. They're looking to raise something in the order of $7,500 or more. That will pay for about 500 meals, and they've already raised $3,000 to that cause. So a donation of $15 will buy one complete meal for a frontline healthcare worker. And I know that some of the restaurants are actually doing it at reduced cost, so we'll buy even more. And for every 50 meals purchased, the campaign will feature a different Hamilton restaurant. So a nice kind of add-on to keeping some of our restaurants, going, more than they have in the past. So congratulations to Sydney and Alex for creating this great campaign, and hopefully that'll generate some gratitude and put a smile on some people's faces that are really working hard out there to protect us and keep us well. So thank you, Mike.
Well, Mr. Mayor, thank you very much for that. And yes, some nice news. We all need it right now. We're going to continue to move on now to some of the questions that have been coming in from our viewers. Dr. Richardson, we would like to start with you. And as we usually do, let's start with a general update about COVID-19 cases here in Hamilton. And can you tell us about the current situation?
Absolutely, Mike. So we have some good news on this front today as well, because today we actually had, or yesterday, I should say, leading up till noon today, we had no new cases of COVID-19 here in Hamilton. And in fact, one of the people who'd been classified as a probable case with further investigation, we determined wasn't actually a COVID-19 case at all. So we're still stable at 354 cases here in Hamilton as of noon today. As always, you can find a lot more details about various demographic information, age, all of those sorts of things on our website, and all of the risk factors. A couple of highlights again, though. 171 cases so far are resolved. That's almost 48%. And so that reminder that for most people, this really is more like a bad cold. And they do go on and resolve and get through this just fine. Of course, it is the people who are older than age 65, people who have chronic medical conditions like kidney disease or heart disease or asthma and respiratory disease. Those are the people that we're really trying to protect with all of this to keep them from getting infected and, of course, getting the severe consequences of it. And on that note, unfortunately, reported to us over the last 24 hours, we did have one additional death in a 96-year-old woman who had come from the Cardinal Retirement Residence. And so our condolences very much go out to the family who've experienced this loss, and our thoughts are with them. We do have 4 institutional outbreaks that are continuing to go on, and 3 of what we call community outbreaks. People ask us why we call them one of each, and it's a bit of just a technicality in terms of the way we term them. But starting today, we have begun posting more details about our outbreaks on the website. So we've been, people have heard the updates when we do the media briefings or we do the town halls here like now, but we decided to make that information accessible 24/7 to people on our website. So you'll be able to see the name of the institution or the community organization where that outbreak is occurring, the number of confirmed residents who are related to that outbreak, as well as staff, and ultimately as well when that outbreak has been declared over. And on that note as well, we've continued to have outbreaks declared over, the first one having been at Wentworth Lodge, our very own Wentworth Lodge, but also at Kingberry residence as well. That one was declared over. So good news as we go forward with things moving along, and with many of the settings, not a lot of spread that is happening within them. However, we've been hot on the tails in terms of doing preventative work and wanting to make sure people are very much prepared for it within retirement homes, long-term care homes, residential care facilities. And so we have been working through with each of those settings a sort of checklist to look at, how are things there? Are they well prepared? Do they have the staffing they need? And we're doing that in collaboration, of course, with our Ministry and Retirement Home Regulatory Authority inspectors, as well as the hospitals who are coming on board and looking at these things and looking at how they can help to provide support to them, whether it's infection control practices or whatnot. I will let you know that we did end up, as we go through the process, we assess how they're doing, we educate on things that they can improve, and we'll continue to do that. And for those who just aren't able to make the improvements, we do use something called a Section 22 order under the Health Protection and Promotion Act. And so you may remember that we'd issued 31 of those about 10 days ago. We did again over the course of this weekend and into Monday. We issued a total now of 43 different orders to 43 different locations to take the sorts of measures they need to take. So those could be anything from, and almost all of them are, developing an outbreak response plan. So they've thought through what they need to do if an outbreak happens in their home. They may be having a longer term staffing plan, ensuring that's in place, and having the personal protective equipment on hand where they need it in the case of an outbreak. So those have been issued. We have checked in. We have found people are very much, this is a reminder of things that they need to do, and most people comply in any case. It's just some that don't, out of the many institutions that we have here in Hamilton. And we're happy to say that with the 31s initially identified, they've all progressed well into coming into compliance. And we're seeing progress already with those that were issued this past weekend. So,
yep.
So I was just going to say, so there's just one retirement home that we're still working with to finish that. We're not expecting any more orders at this stage. And so we'll just continue to work and support the homes in collaboration with our partners. Sorry, Mike.
No, hey, technology. That's some great news, but still no reason for us to take the foot off the pedal. We still have to continue our social distancing, but it is nice to hear that good news story. Thank you very much, Dr. Richardson. Mr. Johnson, we're going to head on over to you now, sir. Can you give us a general update about the recent work of the city's Emergency Operations Center and maybe some key updates since we had this virtual town hall last week?
Well, for those who are watching visually, I got a new headset. So that's a big thing that happened at the EOC, I guess, over this week. But on a more serious note, we continue to deliver the services each day. We're now getting into a bit of a rhythm and helping the community to understand the ways that they can connect with us online, through the phone, and doing the services that are necessary to keep this city moving along at this particular stage. So that work continues. I would say much of our focus, as was last week and into the coming weeks, is our collective effort to look at these congregate settings. where some of our most vulnerable residents reside. For some, it's in a retirement home or long-term care facility. That's certainly been in the news a lot. But recognize that in Hamilton, lots of residential care facilities, group homes, and of course, emergency shelters that provide a service for folks who are homeless. So a lot of work happening there. And across the province, there's a collaboration occurring. You heard Dr. Richardson talk a little bit about it between public health, our hospital system, other healthcare partners, and municipalities to really do everything that we can collectively to ensure that these settings have the staffing, have the PPE, the personal protective equipment, and all of the supports that are required in order to make sure that care is maintained. So a lot of work there. Because as it's been described to me on a couple of occasions, there's sort of two things happening. One in the community, and a lot of those things are very positive, and then one in these congregate settings. And while there's a lot of good things going on there, there still are some hot spots and some areas where there's some pretty tough stuff going on. So that's been a big focus for us. Enforcement continues at the city. The good news is that for all the days we've been in this and all the time that we've had the ability to enforce through fines or laying of charges, relatively few have. We're around the 90 mark. About half of those are for using amenities that people shouldn't have been using. So, we got to keep that message going on. But I would say that the reality is most people are complying, which is good news. We have laid no charges under the physical distancing bylaw. So generally our education and our working with people is successful. And of course, we started last week, and now the application form is up online, and we're going to be starting to review the applications that charities and nonprofits and community groups in our community can apply to the city for some funds to help them help all of us through this time. And there's a lot of great work happening by our charitable organizations and nonprofits, and then just some community groups that have come together to do incredible work. And without them, the city wouldn't be able to do it on its own. We rely on these partners, and the mayor talks about a lot of them in his regular updates. And I just want to say thank you to each and every one of them. Some are looking after a few hundred folks, some are looking after a few thousand folks, but all doing really important pieces of work. And we're really glad that that in this case, the provincial government has offered us an opportunity to provide direct funding to those organizations. We're reviewing them in record time. The goal is quick application, we review it, let's get the money out the door and allow people to do the important work that has to happen through this particular time. The last piece is, as everybody is doing, we're looking at the numbers, and you've heard that our increases today, no new cases and very slow rises over the last few days. That is causing us to work with our other partners, including public health, to look at what some of those next steps may be when the federal government and provincial governments and our local health officials start to talk about some of these restrictions being loosened. But I can tell you that as of today, nothing's changed. And I know everybody wants to tune into these things and hear, today we're doing something different. The reality is right now we're staying the course. That's important. That message has been reinforced provincially today as well. And but it's important for us to start to think about and look at the research that can help drive our decision making as we start to look at the economy opening up, as people talk about the opening up of the economy, but also the opening up of some of the opportunities for people to engage in the community a little bit more than they have been. But that work is a ways off still, Mike. So although we're looking at it, no announcements coming.
Well, kudos to you and the team down at EOC. And of course, collaboration has been so key, and learning all the processes as we go through this and eventually get out of this. No doubt it's a big learning curve for everyone. Thank you for that update, Paul. Mr. Mayor, we're going to head back to you now in regards to today's earlier city council meeting. It was the third virtual council meeting held. Can you give us an update on the meeting and maybe highlight any important decisions council made as it relates to COVID-19?
Sure can, Mike. And, I thank members of council for working through the process of having virtual council meetings. It's been a journey, not unlike what we're doing here today. We're doing that with 16 people. So, everyone wants to have their say, and we have a voting process in place, and it's working quite successfully. So I want to thank our clerk staff for having organized all of that through various means to ensure that we can do that virtually from home locations, and some that are still in the office on occasion. Council did get a request or a petition from a number of people in the community asking to open up James Street North, or to close off actually James Street North, for to allow for more space and for more activity to happen on that street. We have referred that to the Emergency Operations Center, where it rightfully belongs, in my view, so that they can have a look at it. There are some varying opinions, not many, but some. My own personal opinion is that this is probably the wrong thing to do, and I imagine the EOC at this point in time will probably recommend the same, setting up locations where people can be more active in a one location would just draw more people to that location, which is contrary to the message that we're trying to share, which is stay at home as much as you can, stay local as much as you can. If you need to get out in your local neighborhood. So the EOC will have a second look at that, and I'd be surprised if they make any changed recommendation. But at this point, we're not opening up or closing off any streets to accommodate additional activity at this point. Council also requested the province declare community gardens as an essential service. We've had many people, talking about food security and the value of community gardens, and there's no doubt that we all believe there's enormous value there, and it provides a lot of food and resources for local communities that have those in their communities. The province has declared them to be non-essential at this point, so not something that they're prepared to open up. But I understand that the province is looking at that. So, there's potential that in weeks to come, they're going to be assessing this and making an announcement as to whether or not community gardens should be opened up sooner rather than later. So something to keep an eye on, but it's totally in the hands of the province. They put it in their emergency declaration that they are not to be opened, and as it stands today, that's the way it's going to be until such time as the province changes that issue. And you know what? Community partners like Neighbor to Neighbor and others, are all reliant on community gardens, but unfortunately, right at this moment in time, we cannot open them up. Council also approved the city's tax rebates and policies. So some of those rebates have to do with seniors. So seniors do get a tax rebate. I believe the number for those that qualify is something like $198 rebate per year to help them with their tax issues. There's also a city tax deferral program for seniors or low-income seniors that they can defer their taxes until the property is sold at somewhere down the road. So it's a deferral, not a waiving of taxes, but a deferral. And that will continue. That deferral program will continue for the balance of the 3-year pilot that it was instituted for, as well as the existing 40% tax rebate for eligible charities and similar organizations is being continued for the 2020 taxation year as well to help them out. So nothing too dramatic. Obviously, we had some in-camera items in terms of land acquisitions, but these were most of the financial and COVID-related matters that came up today. Most of the COVID-related matters are being dealt with by the EOC, and certainly Council confirmed their support for the recommendations of Public Health and the Emergency Operations Center. Gratitude to all of them that are working so hard to keep our city functioning and keep our city safe at the same time. There are many, many people working in the background and in the foreground, in fact, front and center, paramedics, fire, police, all. And so council was very, very grateful. And so we had many testaments of gratitude for their wards and their communities and how much they appreciated the work that is being done by all of those frontline workers that are working out there to keep our city functional. So on behalf of the city, I would say to Paul Johnson and to Dr. Richardson, if they didn't hear it, much gratitude goes to you and your teams for doing all the great work to keep us safe and keep us functional.
Mr. Mayor, thank you very much for that. Dr. Richardson, a question has come in for you regarding earlier this week, the province released some new models and projections. Can you tell us a little bit about these projections and how they translate locally here in Hamilton?
Absolutely, Mike. We saw from the province the good news that they feel, as Paul's talked about, that the peak may well have passed, or at least we're very much flattening the curve. And when we're looking at the numbers locally here in Hamilton, what excuse me, what we really concentrate on is the doubling time in terms of what how long it takes to double the number of cases that are here in Hamilton. And that number has been steadily increasing thanks to the really important work that has been going on across this community to do the physical distancing that we're talking about, to do the working from home, all the things that we've talked about here tonight. So the thought had been it might happen more so in May that we got to the peak. When we're looking here for Hamilton, we're thinking we may be just at or past that point. So again, it's the really good work that everybody has been doing to stay at home, to keep distance, that has led to that happening a little earlier, we hope, than otherwise. Of course, we wait for, these are models, these are mathematical models, and we wait for reality to unfold before us. Even though we may be at, coming to at or just past the peak, it's still so important that we continue to do those measures. So as Paul said, people may be really wanting to tune in and hear the message that, hey, the day's arrived and we can start to back off on these things, but we're not there yet. We need to do this for a little while longer. Absolutely, everybody is working really hard as well on that long-term care home and retirement home setting, those congregate settings beyond that as well, because there are these two curves that are going on. The one we've been speaking about is the curve that's happening in the community, but very much so there are still significant outbreaks that are happening, and there's still the potential for those outbreaks to happen in long-term care homes, retirement homes, as long as we have the virus in the community. And so we need that, unfortunately, for people to not visit those settings. Those measures will be in place in those settings as well for some time yet to come. So the expanded testing that is planned and going to happen over the next few weeks into all of these long-term care homes, retirement homes, it'll give us a better idea, better sense of what is the extent of the virus being present in those homes. And it'll give us some information that will help us as well as we make decisions and go forward.
Well, that's, again, some great news, and we still have to keep at it. Thank you very much for answering that question. Mr. Johns, we're going to head back over to you now. A question has come in regarding clarification on parking enforcement. Are we enforcing parking during this time, and or are parking meters free?
So let's take the last one first. Parking meters are free right now. So are municipal lots. I think there's a couple of exceptions, the Convention Center and the York Street Parkade, which are still paid parking and barriered for safety reasons. But meters and city municipal lots, if there's a legal space for you to park in, and it's a legal space, so don't park over the entrances and don't park in places that are walkways. But if there's a space available, you don't need to pay. And that does two things. One is it really helps some of the businesses which are relying on people being able to stop and pop in, either to pick up takeout or and some of the workers that are working in and around the area. So we're trying to support people as best we can. But parking goes on a little further than that. There's still lots of enforcement happening. A number of parking lots are closed. You will see signs and barricades that say they are closed. If you choose to move those and move around them and park in them, even if they're a city lot, you'll be ticketed. They're there to close off access to parking lots that are typically near amenities, which are closed, and we're trying to limit the number of people that are traveling to those. Also, if the parking that you're doing is unsafe, if you're blocking hydrants, if you are too close to the corner, all the usual safety precautions that we would put in place, those are still very much in force. The last thing we've been doing since the very early stages of this pandemic is that we have relaxed the hours of parking that are available in residential areas. So if you're under a 1 hour or 3 hour time frame, or the 12-hour limit that's on a lot of our residential streets, all of that has been suspended for now. And that is really to do what we've all been talking about here tonight. It's encouraging people to be at home, for those who have to work at home, and make sure you don't have to jockey the car around during the day or face a ticket. So all of this is to support people to do the right thing. So lots of opportunity to park where you need to park for those essential trips you're taking. And on occasion, this has helped us to support businesses who are still able and allowed under the order to provide some takeout opportunities. Yeah, it's an opportunity that's there for the foreseeable future.
Paul, if you don't mind, if I can please clarify in regards to the parking signs that we do see that maybe will say you can't park here between April and November, or every second Tuesday during these months. Are those spots still available, or can you clarify that, please, for us?
So if it says no parking still and things like that, it's still no parking. So really the relaxations are around those timed parking. So these happen particularly, Westdale would know these well, being near the university, around the hospitals where you've got 1 hour parking Monday to Friday, 8 a.m. till 6 p.m. Those are not in force. But if there are other signs that are up, those are safety related generally. And so, no stopping, no parking, those types of signs, please continue to still follow those.
Paul, thank you very much. Mr. Mayor, we're going to head back to you now. And obviously, this global pandemic is a serious challenge for many folks within our community who may be out of work or can't pay their bills. We know that the federal and provincial governments are offering supports for those who do need them. Can you once again give us a summary of the kinds of supports Hamiltonians can access and how they go about accessing that support?
Yes, thank you, Mike. And I'd say that the federal and provincial governments are stepping up in a big way in many, many different categories. And so, just to touch on a few, you can go to the Hamilton.ca coronavirus website and log on to financial support for individuals page, and all of the available financial benefits are listed there for you to get access and appropriate links to make the application. So please do go there, and you can go to one site and get all this information. But the federal government is stepping up to better support the Canadian Employment Replacement Benefit, better known as the CERB. They're actually relaxing the rules a little bit, so allowing people to earn up to $1,000 per month while collecting the CERB. So not only they can still work and not have a clawback. They've extended the CERB to seasonal workers who may have exhausted their employment insurance benefits and are unable to undertake their usual seasonal work as a result of the COVID outbreak. And they extended the CERB to workers who recently exhausted their EI regular benefits and are unable to find a job as well. So the CERB will apply to all of those folks. The federal government also announced a $5 billion farm credit package to aid the agricultural sector. So I don't have all the details in terms of how that rolls out, but I think that will be identified in the Hamilton.ca/coronavirus website as well. And today announced a $9 billion support for post-secondary students and recent graduates. And we know that many are left in the lurch right now. Some of them are just recently graduated. Some are potentially going to graduate. And so, where do they go from here? And so there's supports out there for them. So the plan will help provide the support they need for the summer, help them continue their studies in the fall, and help them get experience that they need to start their career. So obviously a financial benefit that'll help them get through. There's also a proposed Canadian Emergency Student Benefit, which would provide support to students and new graduates who are not eligible for the Canadian Emergency Response Benefit. So that's an additional. Well, this benefit would provide $1,250 per month for eligible students or $1,750 per month for eligible students with dependents or disabilities. So that benefit would be available from May to August of this year. The province is investing $11 million to deliver meals, medicines, and essentials to seniors and people with disabilities. That's certainly a real need out there right now, and certainly they're filling that gap. You can visit OntarioCommunitySupport.ca to get the support, or you could call 211 if you're in need of that support. That support is available to you, and the guaranteed annual income system gains payment will also be doubled. So that provides some additional support for those that are making that application. And the financial support is also available to help individuals and families experiencing challenges due to COVID-19. So all of these supports are available on the Hamilton.ca/coronavirus website. And you can go to financial support for individuals, and this page is updated every day. So and every day there's a new announcement, and that would be put into that site. So you can go to one location and it can provide you all of the locations or all of the programs that are available out there right now. And anyone requiring assistance over the phone in Hamilton directly, you can call 905-974-9848. We have operators equipped with all of that information as well to connect residents to the assistance that are available out there. So you can, if you're having difficulty, you don't have a website, you can do this by phone by going to 905-974-9848, and those operators can direct you to how to make these applications for all the assistance that's available. So, governments are stepping up in a big way, and, necessarily so. And hopefully it will get us through this crisis. And then we'll see what economic stimulus starts to look at as we start to move out to try and get people back to work. And, obviously, what does that work look like? And how can we inspire the next level of employment? And I know our federal governments are looking very, very hard at the next level of stimulus that's going to be necessary to bolster our economy.
Mr. Mayor, thank you very much for that update. Truly appreciate it. We're going to continue on. Dr. Richardson, a question has come in asking, why doesn't public health share specific information about individual cases? For example, if someone who has been diagnosed with COVID-19 lives in a certain area of the city, so that others living in that same area can take precautions.
So that's a question we often get in terms of understanding where cases are happening and people wanting to know what's going on. And that's, of course, very natural. We all want to know what's going on and what's happening in and about us. And particularly at these times when we don't necessarily know a lot and we're looking for things that we can do, things we can control in our environment around us. And so, it can be frustrating for people when we say, no, we don't give out that kind of information. So the first reason we don't do that is because essentially when we're looking at COVID-19, we know it's out there in the community. So whether it is on your street or not, on your block or not, in terms of a case that's specifically been diagnosed, all of us need to be taking the precautions that we're talking about. And I think, Paul, you've said it particularly in the past, or yourself, Mr. Mayor, in saying just assume it's there, just assume that is the case, and then act accordingly. So, we've talked a lot about the distancing measures that are so important for that. We've talked as well about the recommendation that people consider wearing masks in case they happen to be a person who may have COVID-19 and still be asymptomatic and not know that they're actually carrying it. So all of us should be acting as if either we may have or we may unknowingly be near somebody who has COVID-19. The other really important reason, and we've seen this through all the privacy legislation that has been enacted in this province, in this country over the last many years, and the very important privacy policies we have here at the City of Hamilton, is that we do need to respect the privacy of those that are affected. So we only release information about specific cases or specific workplaces where we think there's a real public health reason to do that, where people, need to understand that there's something that's nearby. So in every case that we get reported, we do that detailed case investigation to look at who might have been the person, or where might it have been that person obtained the virus, got infected with it, and who might they have infected. And so sometimes that does involve workplaces or other places of concern. And so you might see, if you're at work at a certain place, that there's a notification that goes out that there had been somebody there that had COVID-19, or that you're recommended to go for testing and that sort of thing. So we do follow up on an individual basis, and sometimes we do share that information, but we don't do it in a public way.
Wonderful. Thank you very much. And makes a lot of sense. Mr. Johnson, we're going to head back to you now. Can you please give us an update on what the city is continuing to do to support the vulnerable populations within our community in terms of shelters and housing for those who need our help at this time? And how are things going down at First Ontario Center there, the shelter, and how is physical distancing working within this environment?
So First Ontario is going well. Can't say enough thanks to our own staff and the staff from the Good Shepherd Centers. Good Shepherd Centers is actually operating that shelter on behalf of the city, but our own staff helped get it going. They certainly did all the negotiations to get us into that space, and then Good Shepherd came in with their tremendous expertise in this area. It's going well. We're up to about 50 people within that space, and so that's where we set it out to be. We have a little bit of surge capacity there to go beyond 50, but of course we don't want any one shelter to become too big. in order to keep our testing regime up and our screening regimes and making sure that that people are kept safe. Physical distancing in terms of setup is very easy in a large arena like First Ontario Centre. And so we've done some things intentionally. So people may have seen the pictures of the setup. Meals is an interesting piece, for example. We've got folding tables. They're probably the 6-foot tables, and you can sit at either end. So it's 2 people to a table. And that means they're essentially pretty close to 6 feet between people, even when they're eating. And that's really important. Normally in these congregate settings, people would sit an awful lot closer to each other while they eat, and that could become a bit of a risk factor. So we do things like that. The beds obviously are spaced well apart. There is a challenge, of course, the behavior of individuals, and as people are milling about, and these are not prisons, so people do come and go. So we try our very best, and the staff are very good there at helping people to understand why physical distancing is important within the shelter, and they try their very best. So are there occasions, I'm sure, where people come together and want to have a chat and want to sit closer together than that 6 feet? Maybe, but we do everything in our power to set it up that way. Overall, the shelter system, this has allowed us to have less people in each of the men's shelters, which was good. In terms of women's and family shelters, we're utilizing some hotel spaces, again, to make sure that we're not overcrowding our shelter spaces. But these become and still remain very high risk areas. So we're really pleased to be working with the health community and with public health to constantly talk about how we can do our infection control well, how we can do our screening well, and if there are symptoms within individuals using the shelter system, how we undertake the appropriate screening and testing if necessary to ensure that we know what's happening. And if someone is COVID positive, as we did have early on in this crisis, they have access to the isolation shelter set up at Bonetto Recreation Center. I'm pleased to say it has had the total of 1 person in it through its existence from the very early stages, and it's currently empty. The person who was there was cleared at the end of the day, recovered nicely from it, and so we were able to move on, and so was that individual. So those are some things that we're doing. Lots of access to hotel spaces to help even this out. And again, a big thanks to all the people that are helping us to be successful in terms of the vulnerable populations. And then that extends to a whole bunch of other work that's going on. And I'll just share one that I haven't shared in the past, which is we have teams of drivers. They're actually from our recreation division. Of course, all our recreation facilities are closed. These folks are delivering food to individuals who are isolating, who can't get out, but need food delivered. And it's just another wonderful way that we're redeploying some of our own staff in this case. But this is happening, whether it's caremongering groups, whether it's happening in social housing with the staff that are there. People are making sure that those who need help at this particular time are able to access it. And so we could spend an entire hour moving through all of these groups in the community that are doing their very best to support those who are vulnerable through this. And then our particular mind goes, of course, to those who don't have a home, because it's easy for the rest of us to be told to stay at home, stay close to home. When you don't have a home, we put a little bit of that extra energy and effort into it. And I'm really proud of the work that's happening to date.
It sounds wonderful. And it's great to hear of all the community groups and volunteers truly coming together as one. Mr. Mayor, a question has come in to you where you've spoken before a bit about what the city is doing to support the business community. Can you give us an update on that work?
Yes, Mike, good question, and something that we've got a whole team working on a regular basis. So obviously our economic development team is very focused on helping local business, and they've partnered up with our chambers, 3 chambers of commerce. They've created the hamiltonchamber.ca/COVID-19 website. There's a lot of information there in terms of the kinds of help and supports that are available to businesses. There's updates on some of the new developments, the resources that are available, direct links to information on the financial relief available from all levels of government for business directly. So do go to that site again at hamiltonchamber.ca/COVID-19. You'll get a lot of information there. Our economic development team has actually developed a business survey that is going to ask all businesses in our community what are their needs now and what are their needs going to be in the future, whether they're a big business or a small business. What kind of, there's a long questionnaire, and I encourage people to go to the survey. Some 500 companies have responded already. And that survey is going to be very, very useful as we start to develop a task force to talk about what happens when we start to open up. How do we do that? What kind of interrelationship does there need to be between public health and the business community? Obviously, there's going to be pretty direct relationship. Is opening up as per usual is probably not going to be on. So there are many things that are going to have to be factored into what gets opened up and when, and what kind of precautions are going to be necessary. So all of that task force work is being developed right now. Our survey is going to help inform the kinds of needs that our community is going to have, our business community is going to have, and it's going to be open until Friday, the April the 24th. So I encourage anyone that hasn't yet dialed into the business survey, do that at investinhamilton.ca. Take the survey, answer those questions, give us some data and information about what your needs are going to be. And from that, we are in the process of actually developing a terms of reference to ensure that we have a team, well positioned from business, from health, from all sectors in our community that can start looking at how do we successfully get back into some semblance of open for business in our community. So a lot of great work happening. I thank the chambers for their ongoing support and effort, as well as our economic development team that continue to work on, what businesses need to be supported right now, how can we do that, and what do we need to do when we come out of this? How can we actually make that a successful opening rather than scrambling to figure out what we need to do next? We'll have a plan in place that will address some of the issues that we learned through the survey. So a lot of great work going on. Can I just say, on the homeless side that you mentioned a minute ago, Paul Johnson was not going to take any credit for this, but he came out of the shelter sector in his previous employment, and he's taken all of that knowledge and talent to help the homeless in our community. And I don't think we would be as well advanced in that area. And I know he's going to throw it over to his staff team and everyone else that's doing the great work. But his knowledge and understanding of the homeless shelter community has been so invaluable, and he's brought that to great value by looking after the homeless in our community in a very, very, very positive and very, very big way. So I just want to throw a kudo out to Paul Johnson. He doesn't need to say anything, but every once in a while, people need to acknowledge, the talent and the good work that they bring to the table. I can tell you, Paul has brought that talent to the table, and it's been very, very effective, along with many other people, of course.
Well, thank you very much for that, Mr. Mayor. Truly appreciate that. We're going to continue on now. Dr. Richardson, another question has come in regarding the new drive-through testing center as it's opened here in Hamilton. Can you tell us a bit about this testing center, how it works, and how a resident can go about getting tested if they need to?
Thanks, Mike. It really is a bit of a fun center in many ways, this new center being at the Dave Vanderchuk Mountain Arena, and the ability to drive into the arena through that Zamboni door and perhaps do something that you've never done before, which is drive your car through an arena like that. But essentially, this is our newest center that is up and running. We do still have the two other centers, one in the west and one in the east. This center was opened up on Friday at 25 Hester Street there at the arena. It is a single lane drive through. Basically, you drive in through the Zamboni door and then continue on around. And we do have plans in place for vehicles that are too large to go through that door. There may be some large diesel vehicles or things like that that can't go through that way, and so we can go to them outside of the arena itself. So that venue is open from 10 o'clock to 3 o'clock, 7 days a week, but it's not a site that you just show up to. We do bookings into these sites to make sure it's the right place for you to go in terms of getting a test. And so they're all by referral, either through your family physician or through our Hamilton Public Health Hotline. So if you call up, you'll be taken through a bit of a screening questions and then be referred to one of the sites to be tested. We do make sure as well that then people are, there's not everybody showing up to the mountain because it's easier, but we're spreading those visits across all of the sites so that people aren't waiting. at all. It's again at the mountain site in particular, though, you don't need to get out of your car. Somebody comes to your door who's fully suited up, goes through again some questions with you, and then does the swab right there and then. The other thing to remember is that if you don't have a car and can't go to the David Andrewchuk Arena, we absolutely will help to book you into those centers as well. So it's not like that you absolutely need a car to get swabbed through our drive-through center. So that's the news on that one. Thanks, Mike.
Wonderful. Thank you very much, Dr. Paul. We're going to head back over to you now in regards to a question that came in where they have heard that municipal bylaw officers and Hamilton police have been ticketing homeless people. First off, is that true? If so, why would they be doing that when it would be difficult, if not impossible, for these people to pay the fine?
So thanks, Mike. In terms of our bylaw, municipal law enforcement folks, they have not issued any fines to homeless individuals. There have been a very few through the police, and that is true. But I think we need to realize that it is a very few. And although the police can't divulge all the information about it, they have shared that in certain cases, some of those tickets have been the result of a constant trying to reinforce and educate and have behavior change that was not adhered to. And secondly, some ancillary behavior, such as public urination and open alcohol bottles that were complaint driven by the public. And it's a very difficult balance. And so I do want to assure the public that the police are not out there looking to do this. It is a last resort. And in fact, on a number of other fronts in terms of homelessness, are being very proactive to work with outreach groups, our own outreach teams through the city, other outreach teams that are working in the community through nonprofit organizations or community groups. And their goal is to keep people safe. But on occasion, they've felt the need to hand out tickets. So on the two sides of the house, one, no, not at all. And I do want to give credit to our municipal law enforcement folks. Of course, their job mostly is around the physical distancing and things. And sitting at the table at the EOC, that area said very clearly, Paul, we get it. And see the whole family sitting side by side on the couch and lay tickets out for physical distancing in one's own home. That's the approach they're taking on the street. They are educating. They are indicating to folks, you should keep a distance apart from one another. It's the easiest way to keep safe. But in terms of tickets from municipal law enforcement, no. And where the police are doing it, I think it's important to know the police have shared there's been about 851 calls for service related to the COVID emergency and 34 tickets handed out in total. And that's not homelessness only, that's everybody. So again, I think in size and scope, and sometimes when these reports come out, it can seem as though people set out every day to go and do this. And the answer is no. It's done as a last resort to anybody in the community, including those who are homeless. And I do want to say, I am pleased to hear reports back of the kind of collaborative work that's happening between police and paramedics and street outreach and other members of our community who are really doing their very best to deal with homelessness. That is always a complex issue. And I know people in the community have seen people choosing to sleep outside. And a lot of times they say, or write in or leave voicemails and saying, well, how, if we have these new shelters and we have shelters, are people choosing to stay outside? And the reality is that we can't force people to do things, and people will take care of themselves, just like you and I are. People on the street are too. And we're trying to balance that. It's a delicate balance. And I think that what people need to hear tonight is that the enforcement side and the punitive side is a very last resort and very rarely done. And the other side of it is on a daily basis, there is engagement work happening. There is communication happening with people who are homeless and also those organizations that are there to support them. And I think that's the real message of what's happening out there in the community.
Well, Paul, thank you very much for that. Mr. Mayor, we're going to head back over to you, and we're a little tight on time, so we'll get to the question and then just some final thoughts from you, if you wouldn't mind, Mr. Mayor. And the question is, what kind of things is the city doing to support residents who may be new to Hamilton or Canada?
Yeah, and immigration continues. You know what? This mayor is an immigrant to this country, and what we developed about 10 years ago was the Hamilton Immigration Partnership Council. It's been working now for 10 years to ensure that we are a welcoming community for the immigrants that do come here, that there's supports available for them. And so that team has been sending out multilingual COVID-19 related messages via their social channels. So the hamiltonimmigration.ca website is also available to them, and keeping them up to date in terms of some of the COVID-19 announcements that we're making that necessarily they can't access through English, is being made available to them in their various languages. The Hamilton Chamber as well is doing a translation widget, which translates all of their information for businesses into in whatever language is required. So very positive. I'll end on you were going to ask me about Leaf and Yard program. I think there's cheering in the streets that the Leaf and Yard program is back into place. It's different. It's not going to be the same 1 day collection period, but folks that put it out on a Monday, beginning this past Monday in Ancaster, Dundas, Flamborough, Glanbrook, and Stony Creek. And all of this week they'll collect. And next week they put it out on the Monday, and it'll be collected sometime during the week in the lower city and on the mountain. It's the best we can do at this moment in time, but I know that it's been an issue for a lot of people in our community. And in terms of final comments for me, Mike, again, we've had lots of positive effort happening in our community, and we can't thank our citizens enough for the great work that they're doing. You and I and everyone else are all yearning for a day that we can relax and hug our grandchildren. I've got a little grandchild in Mount Albert that if once I do get a hold of him, I'll probably not let go of him for a week. We miss them all dearly, and many other people are in the very same situation. So when we say we're all in this together, we're all struggling with the impacts of what's happening in our community, in our society, in our world, quite frankly. And so keep doing what you're doing because it's the right thing to do. I think our information sharing with the community at large as to why it's important, I think I certainly resonated with the vast majority of our citizens. And as our councillors said today during our council meeting, each in every ward, people are doing what they're asked to be done, asked to do. They're listening to the public health recommendations, and the appreciation for all of that is a great big thank you to our community because it's critically important and very much appreciated, and it's to our collective benefit that we keep at this until such time as public health tells us that we can relax a little bit. So we're all looking forward to that day. But in the meantime, it's working. Keep at it. And thank you for all your effort out there in Hamilton.
And it certainly is nice, Mr. Mayor. I know you've been out and about, and I've heard you mention it as well. Boy, it sure is nice to see people walking, keeping a social distance, but creating some new friendships, having some new conversation. We are truly coming together.
Hey,
Mr. Mayor, thank you.
Bike riding in Hamilton now is just a dream because you can go anywhere and traffic isn't an issue. And so for those that are into cycling, good time to gear it up.
It certainly is. Thank you to everyone watching and for your questions tonight. And of course, thank you to the panel and to you, Mr. Mayor. As we get to the close of tonight's program, we want to remind you once again that the city is accepting donations of personal protective equipment, otherwise known as PPE, to provide much needed resources for the citywide response to COVID-19. The equipment will be provided to frontline workers, emergency responders, and other healthcare professionals. The types of equipment that will be accepted include surgical masks and N95 masks, impervious gowns, gloves, face shields, and other eye protection, swabs, alcohol-based hand sanitizer, and of course, powered air purifying respirators. The city is requesting these items from local healthcare providers, pest control, hospitality providers, nail salons, and construction companies. Homemade equipment will not be accepted. And to donate, we ask that you please email ppe@hamilton.ca, or you can call 905-546-2424, extension 2257 for more information. Of course, I want to thank our panel, our American Sign Language interpreters, and our production team for making tonight's town hall possible. Please, Hamilton, continue to monitor all of our local media outlets for the latest news and updates from the city of Hamilton regarding the COVID-19 outbreak. We all must continue to do our part to ensure we get through this together. We will be back again next Wednesday night at 7 p.m. to answer more of your questions. Hamilton, look after yourself, stay safe. I'm Mike Fortune. Thank you and good night.